In my defense, Amy, it's pajama day here at one of our childcare centers, and I have external meetings, so my solution is a bathrobe over my normal working clothes.
I have heard this trend of pajama days on Halloween.
It's actually I think it's very thoughtful. The team has
It
been doing
is.
it for a while. It's
Yeah,
accessible to every child,
right.
regardless of culture, socioeconomic conditions. Everyone has pajamas, and the
Yes.
staff are in some awesome pajamas today.
I'm sure. I'm sure. That's pretty amazing. One of my favorite stories is when I was teaching at BU, we had the students did a presentation, and one of the supervisors was a teacher it was pajama day, and she did not bring a change of clothes. So she came to the BU student presentation in pajamas. And we have said, well, there's not many rooms you could walk in and be welcomed, and this is one of them. So, I'm back in Boston. It was so great. Just want to thank all the 9:30 calls that joined us yesterday when we were live in Springfield at the the Northeast Regional Convening for the Alliance for Early Success with the 7 states. It was great to kind of have the other folks be able to experience the 9:30 call. So just really appreciate folks joining yesterday. And Gerry Cobb, we're so excited to end the week with you today. So thank you so much for joining us. And so, Gerry, our first question that we ask everybody is for you to tell us a little bit more about you and how you came to be in your current role. And then we look forward to hearing your update. And just so folks know, I've known Gerry a very long time and saw her most recently at the Hunt Institute for Early Education, the summit that was in the beginning of September. And Gerry did an incredible kind of she facilitated a panel, but had a chance to share some information, and as always was on point. So Gerry, tell us about you, how you got to your role, and then we look forward to your update.
Um, Thank you. I appreciate the opportunity to be here. Should I pull up my slides or?
Sure, I was good. Sorry, I meant to say that, and you can share your slides. That'd be great.
Okay, great. Yeah, Amy and I saw each other. I've been hearing about the 9:30 call for years now, and never had the opportunity to experience it. And had a chance to catch up with Amy while we were in Las Vegas at this meeting, and was so appreciative of the opportunity to be able to talk with you guys. Let's see. Can you see? Yeah, you can see the slides now?
We can, yep, it just went into present. And Gerry, that's the hardest part of the 9:30 call. So mission accomplished.
But it's great to be here. You know, you guys in Massachusetts are famous. We all watch the great work that you do and the collaborative efforts with Envy. And you know, this has been going on for decades. I'm from the state of North Carolina originally. And I'm living here now. That's my view from my desk behind me, but have always followed the work in Massachusetts and really the trailblazing work you guys have done for so many years. And this 9:30 call just being one more example of it, navigating the issues you confronted during the pandemic and still finding a way to be innovative and strategic. So it's great to be here. I am with the JB and MK Pritzker Family Foundation. We're based in Chicago, although I work remotely from North Carolina. And we have two parts to the foundation. The Illinois focused area, which focuses on community health and social justice and early childhood, and then the Pritzker Children's Initiative side, which is national and focuses exclusively on prenatal to age 3. Our whole vision is around this North Star of assuring that children and families get the supports they need beginning prenatally to assure the healthy birth and development of infants and toddlers by age 3. And so that's the work we do across the country. It's we're a foundation that is very mission driven, but try to do it in partnership across the country at the national, state, and local level, and to really learn from the process. And we've learned a lot over these years of this prenatal to age 3 work. When we first started, we were pretty narrow in our thinking, focusing on more traditional early childhood supports. And don't get me wrong, those are still important. That's been a huge part of my career for 30 years. But what we've learned, though, over the last 6 years is that there are even bigger needs, and that if the family has the economic supports they need, then the infant and toddler is going to have what they need as well. And so we've really broadened our focus, and really appreciate the opportunity to talk with you about this and get your feedback as well on these talking points. But we broadened our focus from that more traditional, more narrow frame to be more inclusive of the needs of the whole child and whole family, and thinking about what is needed to assure the healthy birth and development of each and every child by age 3. And that means for us not only childcare and home visiting and early intervention, but also things like paid leave, housing, tax credits, and other family economic security supports. And as we've gotten into the details, it's just made it an even more compelling case for why we've got to do this work. So for example, we're now focusing a lot around homeless families with infants and toddlers, and those that are housing insecure. And there are nearly 400,000 families with infants and toddlers that are homeless today. And that's just what we can document. So we know the number is a lot higher, and doesn't count at all expectant mothers that are homeless, families that are living on a couch or a cheap motel room or in their car. And we know there are huge health and developmental and mental health impacts to a baby or a toddler that is homeless. It literally impacts their health and development for a lifetime. And yet they're virtually unseen and rarely prioritized for housing and services. When we tried to talk to people about it, they just look at us in horror and say, no, we don't want to prioritize one more group. And the focus generally is on veterans and homeless men. And I get that, but they're the ones who are seen, and so they get the supports more. But with rising rents these days, we know that that number is rising even more with families that are homeless. In my home county in North Carolina, it's a rural county. 80% of families that are homeless all have jobs. They just can't afford rents around here. So it's really an urgent one. The other thing we started to focus on more as another data point is families with young children in the child welfare system. At least 40%, as much as 50% of child welfare caseloads are children under the age of 3. And so how do we assure that the child welfare and early childhood systems are working together on prevention strategies to assure families are not entering the child welfare system? And from my perspective, child welfare prevention starts prenatally and at birth. And so what's the role that we can play in the early childhood system to assure those families never even enter the system? Another key point, nearly 17% of children under age 6 insecure, and this number also continues to rise, and not surprising given how many millions of children under age 5 live in poverty. And we do have SNAP and WIC benefits, but often they aren't getting them because there are too many hoops to jump through to get those benefits, or they simply aren't aware of how to take advantage of them. Which brings us to another key data point. $140 billion in public benefits in just 7 programs already appropriated are left unclaimed every single year. And an estimated 9 million Americans qualify for those public benefits and aren't receiving them. For Massachusetts, this is a report from the Urban Institute, the calculations they did. If you fully utilize those benefits that are available and that families are eligible for, they would have received 5.5 billion more in benefits under full funding and participation in those programs, and the child poverty rate would have declined to 5.5%. That data point is from 2022, but that's specific to Massachusetts.
And Gerry, that was the data that you presented in the national data point, which is what caused me to run up to you, because I think framing it that way is very powerful, to think of the money that is available and not getting used, and really appreciate the Massachusetts statistic as well. So thank you for that.
We're funding greater capacity from the Urban Institute in their systems to be able to offer even deeper data around this going forward. So that's work that they're doing now. We had originally funded them to do this work specifically for Illinois as part of our work on the Illinois side of the foundation. But everybody needs to know this information. And this doesn't even cover all public benefits programs.
Right.
It's just a handful. It doesn't even include Medicaid. So if you included Medicaid in this, the number would be even higher. But it's just the programs that are in this particular data are CCDF, TANF, Low Income Energy Assistance Program, WIC, SNAP, and Social Security. And we know that it's not for a lack of need that these benefits aren't being used, given that so many children are living in poverty. And as you think about the systems that we're building and the policies we're passing that impact families with young children, we just are thinking more and more about, what are the barriers and challenges that we're setting up in our very well-meaning way to utilize the benefits that have been funded already and that families are eligible for, and what can we do differently. We're increasingly focused on not just passing a policy or an appropriation, but making sure that beginning with design through implementation, that it's being implemented in a way that reaches those furthest from opportunity, and thinking about how we connect the dots across nutritious food, housing, tax credits, childcare, all the pieces that families with young children need.
So Gerry, I'm just going to go to the chat for a minute. Titus shared that the prenatal 3 frame is very important. PCI greatly influenced the design of our Massachusetts Partnership for Infants and Toddlers back in 2019. And we took the infant lessons learned with us to the early childhood agenda, which we kind of launched in 2022. Wayne Isagari shares, Gerry, there's an organization in Boston called Higher Ground Boston, which has been running a project to house homeless children in Boston public schools and their families, partner with the schools, the regional housing organization, the Boston Housing Authority, and together have housed over 500 children and their families. Brian added that Boston Chime, which is a Higher Ground participating organization. And then one question to keep in mind as you're going, are there any states that have taken the approach of simply distributing the benefits to those who are eligible instead of requiring folks to apply for each program? Kate Warren Barnes added, there's a couple of things in chat. So back to you, Gerry, but just wanted to keep you posted on what's happening in the chat.
I love that. And once again, you guys are thinking so strategically. And there are no states that are trying, that are doing that right now. State of South Carolina, you think little conservative South Carolina, they've actually created a public benefits portal. And the first part of the program was focused on, they used their PDG funding grant money for that. The first part of the project focused on about 60 different programs that a family or like a navigator could go in and look at, what are you eligible for based on just a few simple questions of
Right.
age to your children and your income, and now they're able to actually have a common application that you can apply for as part of that. And so that's been great. Some states are focused on a few programs and being able to have, that kind of portal. South Carolina's is most comprehensive. There's another program called My Friend Ben out of Colorado. That one doesn't have the application side, but they do focus on eligibility as part of the programs. And they're looking at things like tax credits too, making sure families understand the tax credits that they're eligible for as well, and Social Security. But still a long way to go. And just technology projects make it so tough when you're trying to do anything with the state. But as you called out in the chat, the Prenatal 3 Policy Impact Center at Vanderbilt, tells us that if families are getting a living wage, if the state makes it easier to access SNAP benefits, income tax credit. If a child has, this is my modification, they don't exactly say this, they focus specifically on Medicaid expansion, but once the policies are in place, I am sure they're also going to say that continuous coverage under Medicaid from birth to age 6, which a bunch of states are working on now. If they have that, if a family has gotten paid time off when they have a baby, that all of these policies, along with programs like universal newborn supports, good prenatal care, child care, and other more traditional programs and policies, that if a state has that more holistic package of programs and policies, the evidence shows that it is directly linked to healthy child development. And it would be great. We have a new president of the foundation, and he got very specifically focused on paid leave because paid leave, as you know, has such great impact. But it's one policy. And the reality is one policy isn't enough. You have to think holistically across what everybody needs.
That's right. Daisy, I see your hand is up, Daisy. I'm going to let Gerry continue, and then we'll go to Q&A. So thanks, Gerry.
So this slide, for those who have looked at the updated roadmap for this year, focuses on Massachusetts, and you guys, clearly are doing great. You're hitting the marks on, a whole package of policies that families need. There's more that needs to be done on the program strategy side. The Prenatal Policy Impact Center is now calling out, they're very focused on implementation as well. And it's like, you've got the policy or the program, what else still needs to happen? And so it's more granular focus, gives a better sense of things. This other slide, again, looks at the Massachusetts data and where you fall. And in some places, you guys are at the top of the list. And in other places, there's work to be done. But it gives you a real sense of where you need to focus more attention and where you don't. What I don't know in terms of your system, and it's great to hear about Higher Ground, and I will look forward to looking into that more, is the systems you have in place to assure that our families are getting what they need and how the dots are being connected to really make those linkages. And I'll close by just saying one of our partners in another state made a comment in a meeting I attended and said, it'd be much easier if we had a more limited agenda to accomplish, just focusing on a few programs or policies. But she said the reality is, families don't have that luxury of picking and choosing what they focus on. They had to think every single day about how to pay rent, how to put food on the table, how to make sure their child was getting everything they need. And the reality is we have a very siloed system of systems for children and families. And how do we work together to bridge those silos and assure families with young children are getting what they need? And so that is the quest we are on at this point.
So Gerry, I would love also if you could, so what we ask folks, if you're comfortable to share the slides with me and we post them in our follow-up, and then any links, we'll have time to put them in the chat where this information came from, because I think it's very helpful. And we are also really focused on implementation advocacy, which we know is very different. We passed a lot of policy in our budget this year. So I think we've been really focused about that. So it's really reassuring to hear you say that. I'm going to go to the chat, and then Daisy, if you are still want to ask your question. So Kate Warren Barnes added that Massachusetts passed the Common Application Bill a few years ago, but there have been major technical barriers to implementing one application that covers the range of benefits that have different eligibility requirements, which Gerry kind of intimated. And then someone responded to Wayne that I believe some cities are piloting programs like this. I know Denver is doing direct payments. And so, Daisy, do you still have your question?
I do. Thank you, Amy. Hi, everyone. So I'm a parent. I'm actually a parent partner with BPS. And I know that Boston is working very hard to make sure that parent voices are elevated in these spaces. So, Gerry, my only question is, do you have people that are at the table with live experiences? Do you have the parents or the people that I think what the work you're doing is awesome. Obviously, we all need to be doing that. That's why a lot of people are here today, right? But then are we talking to those that are directly affected? Are they having that opportunity to be at the table to kind of, give their insight and their input to how things could really be better for families as they navigate such a system that we know is oftentimes working against us? And thank you, Amy, and thank you for the 9:30 call.
Daisy, I totally agree with you. It's definitely one of our early lessons learned in this process that families and others with lived experience have got to be at the table and front and center as part of shaping our advocacy, the policy proposals, and then how they're implemented as well. We now require all of our state and community grants that we make that they have families as part of the decision-making process, and have funded the National Center for Family and Parent Leadership to support those states in better integrating family leadership into advocacy, planning, and decision implementation processes within state government as well. And so that is a resource that we're offering to states too to support that work. We've also created a family advisory committee just to advise the foundation as well on the work that we're doing, and now have a parent fellow that works as part of our office and informs our decision making as well.
That's incredible. I would love to hear more. That'd be another great 9:30 call, because I think I added for date. And thank you, Daisy, for the heart and for the question. And also, as you know, the early childhood agenda, we've also thought about lived experience and integrating that and stipending that and honoring that and thinking about not just kind of at the big meetings, but from, like you said, the design, all the pieces. Gerry, I would love for you to just say a little bit more about you. I know you have so much experience in this world, but maybe just give us a little bit of where have you been on this journey when you think about this work?
So I actually didn't start out in the early childhood world. I was doing more political stuff and just got into it because my then governor of North Carolina at the time, Governor Jim Hunt, really prioritized early childhood. And I was such an admirer of his and wanted to be a part of the work he was doing in creating Smart Start in North Carolina, which is our statewide early childhood initiative. And I used to say I know a little bit about a lot, not a lot about anything, but more of a generalist, which is still true. But I do know a lot more about early childhood than I once did after 30 years in this work, working on the ground in North Carolina, and then working nationally, at first sharing the work we were doing in North Carolina with other states that wanted to learn. Literally, Governor Hunt, once he retired as governor, I would take him on the road to meet with other governors and legislators to talk about why it was so important to invest in early childhood, and then went to work for the Build Initiative and never planned to be working in philanthropy. It was just an accident. I was excited about what the Pritzker Foundation was doing and launching this prenatal to 3 initiative, and was telling everybody about what they were doing, and they have jobs they're hiring for, you should apply for one. And then I thought, well, why am I telling everybody else about this job? Maybe I should apply for it myself. But the job is still doing the work of supporting states and communities in trying to build their early childhood systems. But I get to give money away as well, which is a nice part of it. But it's still such an evolution. I mean, for the 30 years I've been in the early childhood world, there's just been so much to learn every single day from all of those on the ground doing this work, and from the data and the increased research we're getting, our wonderful partners at the Harvard Center on the Developing Child as well, informing the work we're doing, and now the work at the Prenatal to 3 Policy Impact Center. But it's just an honor to continue to be a part of this work after so many years.
And Gerry, so for links for where the data that you shared about Massachusetts, where would we go for that?
I can send you that link.
Okay, great.
It's if you go, but it's the Prenatal to 3 Policy Impact Center.
Okay,
and
so it's
State
all in
Policy
there.
Roadmap. Yeah, it's all in
Thank
there.
you,
There's
Amaris, yep,
um,
930 caller has already put it in chat. Thank you,
oh, good.
Amaris.
There's an interesting link in there too that sometimes you can miss, that gives the generosity of states and their policies. You know, you can have these policies, but if they're not generous enough, that has an impact as well. So it ranks states based on the generosity of their particular policies. So, and that link as well,
Wow.
very interesting to look at.
And
Gives you
I had the opportunity to go to North Carolina on a tour organized by Gerry Cobb and Karen Ponder and learned so much about the way that North Carolina set up the system. We got to meet Governor Jim Hunt, and who was so sharp and like knew who was in the room. I'm sure he was well staffed, Gerry, and he had something to say to each of us about our state and our own context. Just an incredible leader and man.
yeah.
Gerry, any advice? Because I think this kind of where you sit now, you know, as state advocates, we rely on the national folks to help. Any advice for state advocates, especially when we've made a lot of policy progress, but we often talked about the Monday morning question, like, so what has changed as I walk into a program or a family child care home?
I think, you know, I mean, what you're doing now is really thinking about that implementation piece, not checking the box and celebrating the win, but looking at really deeply at the implementation piece and going deep in those communities that where the data is the most challenging, and looking at how do we shape this policy for implementation in a way that is going to get to the needs of those families, and others that are doing that work on the ground. And then from there, you know, expanding it statewide, but really thinking as strategically as possible about implementation.
Thank you, Gerry. That's very wise. We so appreciate you coming, and we know we had you scheduled, and we rescheduled you. We appreciate your flexibility to join us, and please, consider this an open invitation to the 930 call anytime you want to come back, or if there's anything that is new or you want us to know, please just let me know and we'll have you back. And we are so grateful to have the resource and all the work that you're doing to make sure those pieces are easier for us to find. So thank you.
Well, thank you. And thanks to everybody for all the great work you're doing and what we're learning from you guys. So appreciate it.
Thank you. So next week is election day on Tuesday. So we we'll have some time together in the 930 call next week. We'll have an updates from the field day. We'll have kind of a I can't remember who else is on the schedule for next week, but we will send the email out, and we are continuing to get people joining. So please continue to spread the word. And we would love to have more folks join us. So have a good day. Have a lovely weekend, and we will see you on Monday morning. Take care. Thank you.